And with that, let me introduce to everyone Philip Ayeni. He is a PhD candidate at the McGill University School of Information Studies. And today he's going to be speaking to us about a systematic review of library services provision in response to the COVID-19 pandemic. So Phillips, I give you the floor.
Thank you so much for the introduction, and thank you everyone for still staying around and then listening to the last presentation, the last but not the least. All right, so let me go ahead and share my screen. Okay. Okay, can you see my screen good? All right, so this systematic review of library services provision response to COVID-19 pandemic, and then this is a manuscript. It's actually undergoing a second stage. It has undergone second stage peer review at evidence-based library information practice, and then so we're working at the third stage revision and all that. So my co-authors are here: Blessed Agbaje and Maria Tipla. So Blessed is from Nigeria, and Maria is also from McGill. So a bit of introduction. As we all aware, there's an outbreak of coronavirus disease, which is caused by SARS-CoV-2 virus. It's a very deadly disease. So it was declared a pandemic on March 11, 2020, and as of April 26, the World Health Organization reported that there's over 146 million cases globally, and then over 3 million deaths have been reported. And of course, this has caused global socio-economic disruptions, and then a lot of lockdown restrictions and all of that. And just like every other organization, that's affected libraries as well. So libraries have closed their doors, just like schools are closed and businesses are closed, and so there's restricted access. And because of this, there's a majority of library services have shifted online. Because of that, we set out to find out its objectives, to provide an overview of how libraries have responded to sudden closure of the libraries due to COVID-19 and what services they are providing to meet the users' needs, because users' needs have changed, and also to examine the challenges that are facing libraries in their provision of these services. So we use the systematic review, as I mentioned. So systematic, just a bit of definitions, is a review of clearly formulated questions that uses systematic and explicit methods to identify, select, and critically appraise relevant research and to collect and analyze data from the studies that are included in the review, as according to Moher 2009. And so systematic review has a potential to produce a reliable knowledge in systematic and reproducible way. It's something that somebody else can reproduce. And this is why we think, because we're still in the global pandemic, we try to get something, and then hopefully we'll be able to reproduce and maybe extend it when the pandemic is over. So we developed set of inclusion and exclusion criteria before we started our search, and which actually informed the studies that we included in our studies. And then that's to be published in scholarly journals. And then if abstract or full text of articles are not available, we excluded them. If not written in English, because our language is English, we excluded them. And if they are anecdotal reports, we excluded them. So we included studies about inclusion criteria. So we used, in order for us to be able to report this, we used follow the PRISMA protocol, which is the preferred reporting items for systematic reviews and meta-analysis. Was created by the International Network of Earth-based collaborators to provide the framework for systematic literature review. And then, of course, this was designed in order to ensure methodological rigor and quality in literature review. So the PRISMA protocol has 4 stages. The first stage is identification. And we're able to identify literature from 5 different databases. And then the second stage is screening, which we first screen the title and the abstract of the articles that we identified. And then the third stage is eligibility. We screen the full text of articles that we identify from the title and abstract. And then we also, the last stage is inclusion, which we included for qualitative analysis. So as we conducted the first search on September 16, 2020, and then the second search was conducted on December 13, 2020. And so we searched 5 databases: Library Information Science Abstract, Library Information Science Technology Abstract, Library Science Database, Web of Science Core Collection. And then on March 22, we searched Google Scholar. March 22, 2021, we searched Google Scholar in order to cater for the new articles that have been published in 2021, and hopefully open access articles that are not covered in the subscription subscription databases. So our search technique, we actually followed we used the building blocks search strategy in order for us to yield high recall, because we wanted to see get as much information from the literature, and then this involves using synonyms and related terms. For instance, we developed a search plan. So we have two concepts: library services and COVID-19. So the first concept, we developed the synonyms for library services, and we did a keyword searching initial keyword searching to identify how library services have been represented in literature, and then how COVID-19 has been represented or used in literature. So for instance, when we searched, so building blocks means that we searched for each concept one after the other, and then we combine the search results with Boolean technique, and which I'm going to show you how that looks like later. So the results, I think you can see my screen good, though the text is a little bit small. So we in total we were able to access. So we limited the result that we included in this protocol. We limited them to 2020, and then for Google Scholar, that's 2021. We have two 2021 articles and 2020 articles. So out of that, when we applied all our inclusion and exclusion criteria, we're able to eventually have 23 articles. So just a bit of results. So 23 articles were included for synthesis. So 26% of the studies from USA, and then 17% of these included studies are from India, 19 are from China. So others are from United Kingdom, Ireland, Canada, Mexico, Romania, Czech Republic, Indonesia, Pakistan, Nigeria, Lesotho, and Zimbabwe. So the other ones are just one articles from these countries. So majority of the studies use case studies, 48%, and then 43% use surveys, and then 9% use content analysis as their method. And the majority of the studies were conducted in academic libraries, perhaps because academic librarians are poised to do research more than other types of libraries. And then, so, we're able to identify 8 broad themes of library services that were provided by these different libraries. So I'm just going to go over each of these services one after the other. So the first one is virtual education and teaching support. So there's an increasing provision. Libraries are ensuring that students and researchers and faculty are getting more access to digital content, and they're also helping in curriculum development. Also creating virtual tours of libraries and museums and collections that would have been done in person, but now it has shifted to virtual. And they're also helping to increase access to open educational resources, and they're providing liaison support for both students and staff. And so there's research support. So there's increasing, because of the demand for COVID-19 information. There is, libraries are providing much COVID-19 information and literature. They are helping to advance, provide advanced workshop in bibliographic management, for instance, EndNote and other bibliographic management software. And there's been an increasing demand for literature searching. So librarians are helping students and faculty in literature searching, and also increasing publishing support for the user. So open access has also gained momentum in the pandemic. As you know, a lot of COVID-19 researches are being made open, and even several publishers are collaborating. Libraries are collaborating more with publishers and database providers for them to lift copyright restrictions on some of their collections. So, and then publishers, they are providing temporary open access to collections that used to be closed in order to, to foster COVID-19 research and discovery. And then there's more access and visibility of open access collections. So this is an interesting one. Libraries are stepping up beyond the traditional services provision. They are also helping to, to provide health literacy much more in the COVID-19 pandemic through lead guides and lectures and workshops. And they're also helping to guide, evaluating information and fact checking. Some people are presented on misinformation and disinformation. And they're trying to evaluate. They are providing guidance for students and researchers, to be able to evaluate and fact check. And then some medical libraries are providing 3D printing of personal protective equipment. Because some libraries have maker spaces, so they are using their 3D printers to print some of this in 3D. And then they are raising awareness and helping to prevent the spread of misinformation. So another service that has been provided by libraries, a lot of libraries are providing virtual reference services. This is not the first time, but there is an increasing effort, to increase virtual reference services provision. And the librarians are engaging in live chats, the email communications has increased, and then the use of social media platforms for answering users' queries as well. And then libraries are providing synchronous online information support to researchers. And also there's an remote digital access to library resources. And this is very interesting because some library resources are only print, they are print only. So librarians are trying to convert them to digital formats. And so they are retrieving the compact disc and DVDs from some books that have them, and they are in order for them to have them in digitalization. So there's an increasing digitalization effort in order to provide more digital access to library resources. And so another interesting service that libraries are providing is welfare and outreach. So libraries are providing, out of library disaster relief packages, just like, how some organizations have been doing this. So libraries are also providing disaster relief packages. They are also promoting social welfare entitlement for people who don't know what is available in their communities. So they're helping to promote social welfare entitlement for students and for researchers. And they're also providing special collections to centralized isolated zones. For example, in one of the libraries in China, they are establishing reading stations for mobile cabin hospitals that treated coronavirus infected patients. So they are moving library services to patients that will not be able to get to them. So these are patients that have been isolated because of the virus. So libraries are actually going to meet them to provide them with information resources. And lastly, there's circulation and lending services. So interlibrary loans have increased in the pandemic, and then document delivery. And then, as you can see, some users are requesting for information resources online, and then some libraries have partially remained open, so users can place their order online, and then they go physically to the library to take their books. And then when they want to return the books, some of them actually they've established some self-medicated checkout stations, and then some drop boxes where users can drop their books without having a personal contact with the librarians. And then these books will be what do you call it, will be treated, or in case of coronavirus infection. So another thing that the challenges, so some of the challenges that libraries have faced, there's an increasing increased anxiety of being exposed to the virus. For some libraries that have remained partially open, their librarians are taking, they're taking shift for those who will be in the library and for those who will be at home. Some are working at home, some are working in the library. So there's been increased anxiety of being exposed to the virus. And some libraries are having difficulties with shifting their services to digital environment. And as you know, as faculty members, maybe those who have not done it before, now they are moving everything online. So it's also difficult for librarians to shift most of their services online. And then especially in developing countries, there is a low bandwidth of internet connection. This has actually empowered the smooth running of their services in the pandemic. And some libraries have reported ICT and infrastructural issues. And mostly, a lot of the libraries in the selected studies reported budgetary and logistics related challenges. So their budget actually cannot cover for the amount of information, amount of services that they need to provide in a virtual environment. And then the cost of training, because now there's a lot of training and retraining going on. So the cost of training has also affected the budget of many libraries. And so the limitation for this study is that this study was limited to only English. For instance, 121 non-English literature were excluded. So maybe a further study will be needed. I'm very sure that there are some very relevant studies out of those studies that might be interesting, right? So if a further study can look into that to check studies that are not in English language. So the pandemic is still ongoing, right? So there are many publications may still be published. So that means there's need to update this study when the pandemic is over. And then we also did not include gray literature in this review, which has been suggested and been proven that it's one of the very interesting relevant sources of systematic review. But we did include some studies that base their methodology on gray literature by reviewing websites and documentation. We included them, but we did not include specific gray literature in our own review. So in conclusion, so libraries are adapting and meeting patrons' needs, despite the pandemic, despite the challenges. And there is a need for structured approach to ensure continuity of service provision. And then libraries need to prioritize the acquisition of electronic resources because most services have shifted online. And there's need to increase digitization efforts of print-only resources. And then government and funding agencies should increase their support in equipping libraries with technological facilities needed to provide cutting-edge services. And of course, this study will be of use to librarians in health and academic sector because most of the studies we included are from the academic libraries and some from the medical libraries. So thank you. And this is an example of a search result using a building blocks approach. This is from the Library Information Science abstract. So set 1, set 2, set 3, set 3, set 4, set 5. So and that's it. Thank you. I would like to listen to questions.
Michel, il y avait une question de Vera un petit peu plus haut.
Oh, wait, sorry, I forgot to unmute myself. So Phillips, there's a question. Did your studies, did your included studies address how the librarians feel about the changing or new services they offer?
I think at a point, we actually focused our study on, because when we're trying to identify the themes, we're looking for specific library services. We're not looking at the perspective of the librarians, but I think that that actually was covered in the challenges because a lot of them are, reporting their financial challenges and adapting to the new environment, and so I think that might be covered in our, in the challenges, but we did not specifically look into the perspectives of the librarians regarding the services they are providing. I hope I answered your question.
There's a comment and a question from Mark Simard. Have you thought about keeping up a website or blog where you could keep this updated every now and then after this is published? I feel like the pandemic is going to have a big effect on libraries and research in general for several more years. You shouldn't have a problem finding new literature for a long time. So the question itself is, have you thought about keeping up a website or blog where you could keep this updated every now and then, even after this is published?
Oh no, I have not thought about that. That's a very good suggestion, and Yeah, so like I said, that we intend to probably update this study, to follow. Just for instance, when the first search was in September, so when we wanted to check for new studies in December 13, we actually conducted a search all over again, which led to some new studies. So it's a very, very good idea. I do appreciate that. So we'll look into that and see how we can do that. Thank you.